Hi, everyone. My name is E. David Crawford from the University of California, San Diego. Joining me are two international experts, Dr. Mara Keys and Dr. Steve Kurtzman, to discuss something called LDR brachytherapy for prostate cancer. This is in contrast to HDR brachytherapy. We also use the term seed implant brachytherapy for this. Dr. Keys, can you summarize your thoughts about indications and outcome and so forth with LDR brachytherapy?
Yeah, so thank you for having me. It's a real pleasure to have this time with you today. So I would just say there is two different types of brachytherapy procedure for prostate. One is called the LDR or low dose rate brachytherapy, where we put radioactive seeds directly into the prostate tissue and the prostate, versus HDR, where the different catheters are placed in and then high activity sources kind of travels around the prostate and delivers radiation. And by the end of the procedure, there's no more radioactive material actually left inside the prostate. So that is quite appealing to many radiation oncologists, and there's a lot of centers in the US that now exclusively offer HDR. However, I would say, in my opinion, there is a real beauty in seeds or the LDR brachytherapy. It is extremely convenient. It's simple procedure, and it takes about 20 minutes, 15 to 20 minutes in the operating room, and as they say, one and done. So this is what I do, and I really enjoy doing it, and our patients are very, very happy.
So give me this in a sentence or two, side effects and outcome with this. So this is what the patients are concerned about too.
Yeah, so the outcomes are really excellent, and long-term outcomes in all risk stratification patients, so low, intermediate, and high risk. They have a very durable PSA response. Most of the patients are cured in 10 and 15 years after the implant. So that is extremely favorable. In terms of toxicity profile, I find patients do very well. There's minimal toxicity, particularly with LDR monotherapy. They have excellent quality of life. Usually young patients preserve their sexual function. There is no incontinence. There's no recovery time. And the transient urinary symptoms that they have after the procedure actually resolved in several weeks to several months after the procedure. So patients are happy, and that really gives me a great joy in doing what I do.
Right. There's no question, not with time and the data with LDR brachytherapy is matured and looks very well. It's up with outcomes similar, if not better, than a lot of the treatments we use. It's been a team approach, and we did that when we started. That sort of fell apart, and Steve, you've hung in there, Dr. Kurtzman, with working with urologists. Can you just summarize what your thoughts are and how do you successfully do this and what the future is?
I believe LDR prostate seed implantation brachytherapy is ideally suited to the ambulatory surgical center setting. It requires no capital costs. It requires no shielding. It's a tremendously efficient procedure that any good surgery center can have great throughput. The real beauty, however, is that we can bring the program to the urologists in their location to serve their communities. And I crisscross the country presenting this as an option for urologic groups to integrate this care into their practice.
Right. Thank you very much. We appreciate it. And I'd like again to extend our sincere gratitude for Therogenics for their support in making this session possible to educate urologists, radiation oncologists, and patients about the LDR brachytherapy. Thank you.